Welcome to the live checkup. This is where we sit down with Dr. Asante Le Blanc and ask all the possible questions we can when it comes to our health and care. Let me just tell you this first off. Dr. Asante Le Blanc is the medical director and owner of Victoria Clinic, your home for holistic health care in Trinidad and Tobago. Victoria Clinic is located at 54 Galley Street in Woodbrook. Dr. Le Blanc is a medical doctor and certified medical herbalist. She is an integrative health care practitioner, bringing together the eastern and western branches of medicine so as to better guide patients on their path to optimum health. She's also a certified clinical densitometrist, specialist in diagnosis and treatment of osteoporosis. At Victoria Clinic, services offered include medical consultations, traditional Chinese medicine consultations, acupuncture, medical herbalism, blood tests, electrocardiograms, lung function testing, and Dexter bone density testing. You can contact Victoria Clinic at 622-2221 or 622-0683. Follow them on Facebook, Victoria Clinic, or Instagram, Victoria Clinic_Trinidad. Website, www.victoria-clinic.net. This is the live checkup. I'm JD. Now, let's jump into today's conversation. Hey, good evening, Trinidad and Tobago, and those of you that are locked internationally. I'm JD, and this is Dr. Asante Le Blanc. We are inside of another episode together. We're calling this, of course, this is the live checkup. So if you're joining us for the first time, welcome. If you've been here before, you know what to do, right? Simply like, subscribe, share, even to the newbies as well, because the information is just so pertinent right now, especially as we go through this COVID-19 pandemic, which many of us have never thought we would certainly be living through. So good evening to you, Dr. Asante Le Blanc. How are you doing?
Good evening, JD. Good evening to everyone, all the viewers. I am well. I can't complain, JD. And you're looking splendid in that red top that I'm seeing.
Burgundy. Thank you. Thanks. Thanks so much. So, Dr. Asante Le Blanc, over the past 2 weeks, we were unable to connect, and that's how it is sometimes, right? But you notice I've been reposting our conversation about COVID-19 and some of those questions, because just even this week, someone just sent me a message asking, Jay, is it okay for us to exercise thinking about not just the mask wearing part in terms of health, making it much difficult in terms of recovery with respiratory issues? So I said, you know what, all this is really just another means for us to continue to have conversations that are sort of birthed or connected in some way to COVID-19, this global pandemic in which we are all currently living. Unfortunately, many persons have died across the globe, but most recently we've lost some persons again in Trinidad and Tobago, so we offer condolences to each and every one of you. I know you keep saying, Jay, it's concerning, when we speak on phones or whatever. Sorry about that. I thought I'd know better than that. Let me put it on silent. Sorry about that. So, we've been having this sort of conversations about just how serious it is, and persons seem to not think it is serious at all. Over the weekend, the Prime Minister made some changes, sort of kind of put some restrictions on many of the things that we're accustomed to doing, like, for instance, the beach and the liming at the rivers. And we saw on Sunday, so many people said, you know what, let me go for the last dip. I want to start off with that. What's your 2 cents on that as we go through tonight's conversation, which is pertaining to cancer patients living or dealing with and their precautions with COVID-19? What do you think about this past weekend?
JD,
Plus.
I understand the need to take that last dip, last river lime. I understand it as a human being. However, what I do not understand is that common sense tells you that large gatherings are a breeding ground for coronavirus transmission.
Mm-hmm.
The Minister of Health said, please don't congregate in huge masses just because we're closing down. And what do? That's exactly what happened. So I was stunned. I was shocked.
Mm-hmm.
I was disappointed. And only time will tell the results of those actions. And
Unfortunately.
that's, yeah.
COVID-19, of course, this is the pandemic. I don't think we need to go into what it is again, but just give us a sort of synopsis of it, please, as we get inside of today's conversations. What cancer patients and their families and even caregivers should know about the COVID-19 or, of course, coronavirus.
So, JD, as we have spoken on COVID-19, coronavirus infection, novel coronavirus infection, um, we have always maintained that there are high risk groups. And the high risk groups are those that if you get infected, you have a higher risk or higher chance of developing complications, which can even lead to your death.
Yeah.
And the high risk groups included the diabetics, hypertensives, obese patients, chronic lung disease patients such as asthma, bronchitis, emphysema, smokers, and cancer patients, to mention a few,
Right.
and immunocompromised patients, so autoimmune disease patients. Um, Cancer patients. So this large group, this large high risk section of the population, the main problem is their immune system may be, and I want you to understand the word, may be lower or at lower functioning, lower performance levels than a person without any of these comorbid conditions, as we call them.
Right.
So in terms of cancer, what is happening? If you've been affected by cancer, you're a cancer patient presently, and you're undergoing treatment such as chemo, radiation, or both, then your immune system is being pressured and attacked, so to speak, because the cancer is, this is how the treatment of the cancer is going to be effective. So what does that mean for you? So all the guidelines that everybody has to follow, which are physical distancing, at least 6 feet apart,
Mm-hmm.
isolating yourself from others who may be ill, using a mask at all times, covering both your nose and your mouth, and not wearing it on your chin, sanitizing your hands with hand sanitizer of more than 90% alcohol content, or washing your hands thoroughly for at least 20 seconds. Do not touch your face excessively. So sometimes we forget, we touch our face. Wash your hands and sanitize. Simple measures, very simple measures. Those have to be kept in place. But for the cancer patients, now I understand that you may be undergoing treatment and you may be weak, you may feel weak, you may need assistance, you may have a caregiver.
Yeah.
That caregiver or that family member that is dedicated to helping you through this difficult time, and it is a difficult time for you, and I empathize with cancer survivors and patients right now, because I can understand that you may be coming from a place of fear, but you cannot be fearful because you're fighting a bigger pandemic and you're fighting a bigger disease, and we're so proud of you. So we just want you to take the extra precautions. So your caregivers have to dedicate their time to observing all these measures we've just discussed, isolate from others, let people drop your groceries at the doorstep, you know. I know it's hard, but this is where the FaceTiming, the Zoom calls, the WhatsApp video chats, all
Right.
of that will come into play to help with social interaction. I know you need a hug. I know you may need a little smile and a little shake and human contact. But at this time, that may be the deadliest weapon around for a cancer patient or a survivor that has just come out of treatment. Liaise with your oncologist, who is your cancer specialist. Liaise with your general practitioner or your doctor. Your team that is treating you, liaise with them and speak to them, because they're the ones that will help to guide you. You know, because JD, right now, this is a very delicate time and it's a very strange time for us all. And
Yeah.
we have to just breathe, take it easy, and see what the next 2 weeks brings forth for us. And as the Prime Minister said, the next 28 days actually.
28 days. And some people act it's like the entire year. Um, so I know one of the things that I omitted to mention earlier on is that, of course, you are the chairman of the Trinidad and Tobago Cancer Society. So this is certainly one of the reasons why I wanted to have this conversation, as well as having a conversation with someone I know going through it, in fact, in remission right now. And congratulations to you. You know who you're talking about, but she's very private. But I know one of the things she's talking about is making sure no one is coming at her home, keeping family and friends away. Of course, when she goes out to get certain things with her family, taking that extra precaution that you speak about. Maybe it's just a totally different, not another notch, really, to try and achieve that. Um, so it may seem a little bit more, maybe they may have more of an anxiety, and we spoke about anxiety before too as one of the things that we're dealing with, many of us will be dealing with. But when it comes to, just simply going in to get our screening and all that, is there anything that we need to do just a little bit differently as well, or is there anything that you would like to say, tell us what maybe the professionals like yourself would be reinforcing during that time? Because like you said,
Well,
some
first
people
of
have to go
all,
get their stuff done.
they have to go and get treatment. So that
Yeah.
will be determined by the oncologist, how what the risks are and how important it is. And obviously all of the treatment centers are working every day to maintain safety of their patients and the staff members. So this is a top priority, and in all, both private and public, they would have set schedules for the patients, and they would advise the patients how to come in, how you go out, how to sanitize, and all the measures that will be in place. JD, it's a trying time for everyone.
Yeah.
There's no doubt about it. Us as physicians, we are here to serve. We have all taken the Hippocratic Oath. And I think all of us as physicians, we know what we have to deal with. We all have families, and we are pleading with you because, like it or not, a GP is just as frontline as the hospital staff. We are the ones that will see the patients, asymptomatic and all. And so we beg of you to just take the necessary precautions and measures. You may see now that your GP may change how they're seeing patients.
Yes.
You'll be triaged on the phone. You're going to have to answer certain questions. I ask that everybody is honest. When it comes to the anxiety of a cancer patient, so in terms of your treatment, you must know by now, and I'm sure someone has told the cancer patients out there, and if not, here goes. A healthy diet, a healthy sleep cycle, reduce your stress as much as possible, and as much physical exercise as your body can handle. You have to be in a position of balance to be able to take on the onslaught of treatment. So you have to, unfortunately, we have to ask you to dig even deeper, to not be stressed and not let the fear and the anxiety affect your immune system even further, because it can affect your immune system. Let this ride out. You have got this. And the Trinidad and Tobago Cancer Society is also here as a support. If you need help, you're not sure, you can contact us at 800 TTCS, or you can get us at projects at cancertt.com, or send a message on Facebook, Trinidad and Tobago Cancer Society, and you will get a response, and we will see how best we can assist. So, you know, we are our sisters and brothers keepers, and we're also their teachers. So I think it's important that we all as individuals are strong enough to say, can you kindly back up a little bit? Can you kindly wear your mask properly? It's important to remember what Dr. Hines said on Sunday during the virtual conference for Ministry of Health that they held on Sunday. And he said, if you're feeling cold or flu-like symptoms, or you're just not feeling well, before you step out, stay home. Call the helpline or call your doctor. Let
Right.
them help you and guide you through the system. It doesn't necessarily mean that you're going to be sent for a COVID-19 test. You may be self-isolating at home. You may be advised to quarantine at home and monitor the symptoms. But listen to what you're told. Do not be afraid. Do not be afraid of the test. Do not be afraid of being quarantined. You know, think of the big picture, which is the health of the population. And the only way for us to get over and get through this second spike successfully is if we all cooperate with each other. This is no longer, it's never been, but more than ever, it's not the government's responsibility. It's our responsibility.
And I always love that statement because we like to pass blame. We love to pass blame as human beings, but this is really our responsibility. One of my friends in the UK was just saying to me a few minutes ago, she says, Jay, it's the same thing here in Birmingham, England. And the thing is, I said, so what, girl, what can we do? And she says, you know what? You got to see about yourself. If that is the only thing you can do at this point in time, keep practice, because you can't force anyone's hand. You can just pass on the information. And it reminds me so much of what my mother says. Everybody has free will and they will do what they want. But we have to just try our best individually to be better citizens and do what we need to do. You know, you're going to hear those persons believing in conspiracy theory, and that's fine. You hold on to that, bro. I always tell people that I am going to stick with what I believe, and I need to secure myself and my family, because this is indeed very scary. And it's just too many persons. On Monday, I think I was reading somewhere, and the figures may have changed because it goes daily, but we're standing at over close to 12 million, I think, cases across the world. That's absolutely ridiculous. So the numbers are
Across the
increasing
world,
across
yes,
the world.
we are there. And I think I said this the other day to somebody. I said, do you know that cancer has been a slow growing pandemic
Mm,
all through the years? And we have made so many strides in the world of treating cancers. And I know that cancer patients, they have two options. You can give in, you can feel like, why me? Another thing, or you can say, I got this.
yeah,
And most cancer survivors, most cancer patients come out with an amazing willpower, because that is your first step to survivorship. And we're here for you. The Trinidad Tobago Cancer Society is here for them, and I think they need to just do follow those steps, and don't be afraid, and don't stress out, because JD, not because you forget to wash your hand one day or
no,
1 minute, it's the end of the world. Don't stress out. Don't think negatively. Look at your glass half full. That is really and truly the best advice we can give. And don't be fearful. And if that anxiety creeps in, use your support network. If
yeah,
you don't have a support network, reach out to us again. But you're not alone. And I think I want it to be heard. I want the cancer patients out there, the survivors, to understand you are not alone. You never were, and you never will be. And when it comes to screening for cancers, the Trinidad Tobago Cancer Society is still screening.
great.
We're going slower because of more measures. But again, we may come to a point where we can't screen for a while because of the COVID situation, but it's all very dynamic, as you know, and very, very fluid.
Very fluid. Yeah, it is. It changes. Well, it doesn't change. It every day is a new piece of info. Can I just go back to something you said, which I guess in some way can be connected to the cancer patients, but by extension, anyone within a household that you may have someone who's feeling ill, and it you never know. It may be COVID-19. It may be nothing at all. Simple flu. But you just spoke about the flop of your own drill of that quarantine drill you did at home. Now, many of us, I always wonder about that. Can you guide us as to how accurately that should be done? Starting off, again, speaking about those who are taking care of cancer patients, or maybe they're in remission and they too have to be a little more serious with that because someone in their household may have it. What are the things we need to do?
So ideally, a cancer patient with a caregiver should probably be the only two people in a house.
Right.
That's ideal. However, if that's not the case, the cancer patient or the survivor may have to have a section of the house, if possible, to themselves, where that's your safe zone. I've put up long ago, and I can put it up again, where
Yes.
there were sections of the house in terms of clean, dirty. You step out of your shoes, you go into the clean section. You took off all your clothes in the dirty section, stepped into the clean section, and you went on. I have to find that and put it up on the Facebook page for Victoria Clinic. But um, you have to see what suits you. So, for example, if a cancer patient is living with a family, JD,
Mm-hmm.
they do have to, and the family is going out and in, then that patient, that survivor will have to isolate in the home because they're at risk for you going out and in. So this is where you may be in the house, but you're not able to see that person. You can talk through the door, but you can't see the person. You understand? And so it's very important that you think about the layout of your house, think about your situation, and how best you can isolate. So for example, if a cancer patient is going for chemo, they're going with their caregiver for chemo. From chemo, the hospital, they go back home. You
Yes.
know that that day you may feel well, but the next day you may not. So you need the caregiver there. You and that caregiver have to be alone, isolated, and nobody comes in and out. Because the minute somebody goes out and comes in, that's a risk. Unless they're extremely meticulous with taking clothes off outside,
Yes.
bathing before you come into contact. And these things, my family would laugh at me sometimes, but it's no longer a laughing matter. Where
So,
I come from work and I strip at the door
mhm.
because I have come in from my clinic, and that's where I have met all patients, whether symptomatic or asymptomatic. And even though I had on my PPE, I still have to strip at the door and immediately go for a shower, and then I could say hello to everybody. Now, if you are sick and in the home with a cancer patient, my best advice to you is to stay clear of that cancer patient.
Mm.
Stay clear. Don't come into contact at all. Do not share the same utensils. Do not share the same glass, nothing. Stay clear. You have,
Oh,
but families have to have that discussion.
what do we do with the bathroom? Thinking about that. That let's say
Right. So if
a
you're
has
if
one
you
bathroom.
you you're not supposed to, right. So if you have one bathroom, that bathroom has to be sanitized before and after everybody uses it. So the cancer patient and then the rest of the family.
Yeah.
So if you have two bathrooms, there's one bathroom designated for the sick person and the rest for everybody. Or in the cancer patient's situation, one bathroom and room for the cancer patient, and the rest will have to do with
To another
whatever
room.
is there. Yeah.
Yeah.
It's very important to understand, and so that is a difficulty, JD. So that is a difficulty. What about you know cancer patients who have children?
Yeah, I thought about
So
that's what I'm,
your child comes home,
yeah.
mommy is sick, daddy is sick, so this is a very trying time for us as a human race in terms of physical contact and physical emotional support, and we have to adjust, and we have to adjust, and we have to understand that this is for a greater good. You understand? But JD, I think people have to have frank discussions. So like with my family, I said, this is a flop. So we have a room downstairs. I've set it up. Anything happens, that's where you go.
Right.
No ifs, ands, and buts about it. Your food will be placed outside. You can speak to us through the window. So yeah,
I
I came to my realization that we have to have that discussion,
and you're right.
and you
This
have
is a
to have
discussion
you
we all
yeah.
need to have. We all need to have because if you are the doc and you're saying, we flopped, can you just imagine for many of us who are just taking so many other things for granted, you know? And like how
Right.
you raised the question about a parent and children, because there are many single parents out there, and I can only, that's a challenge for them too, having to take care of the young ones and take that care of themselves, you know. So COVID is just one of those things that just has us shaking our head consistently. But I really
And
want, go ahead, go ahead. Sorry.
it's a disease that it's new, and you can only do so much.
Yeah,
And I don't think people should over obsess, but think before you act and be safe, for sure.
for sure. Any final words? Because I knew this was going to be a sort of a short conversation because we're hearing so much about COVID, but I wanted business to get those points, especially those who are dealing with cancer. But any final words
I
before
think
we wrap up?
I want the population of Trinidad and Tobago to understand a few things. First of all, to the cancer patients, cancer survivors, supporters of the cancer patients and cancer survivors, take a deep breath. Do not let fear guide you now. There's support for you. Just do the right thing. You are special in that you now if you're fighting cancer, and this is another stumbling block in your pathway.
Mhm.
To all of Trinidad and Tobago, I think after looking at social media over the past few days, I think we need to stop trying to find out who is where, who had the party where, who did what where, who didn't do what where, and stop throwing blame and throwing responsibility. We have to be responsible and accountable for ourselves. We have to recognize our flaws. The government has been doing their best. We have come, this is a natural progression of a pandemic.
Hmm.
We can still stop this, but we have to follow the rules.
That's going to be hard because, and I
And
say
these
that
are not rules set by the government.
exactly. That was going to be my point. This is not just a local thing. You have human beings in Spain not too long ago protesting because they had to wear the mask. I
Well,
feel
everybody is protesting. So, you know, I think we are blessed with our fresh air. We are blessed with our culture. We are blessed with our fruits that are natural. We
yes.
are blessed with our fertile soil and our food. Let us all try to eat as balanced as possible and as natural as possible. Let us all try to sleep the best way we can. Exercise the best way you can. Remember, you cannot exercise with a mask if you're doing a high intensity workout. If you're doing a stroll, you could stroll with a mask possibly. Remember that you need to physically distance, use your mask covering your nose and your mouth, wash your hands, and sanitize.
Hi, Zoe.
Wash your hands for 20 seconds. Sanitize with hand sanitizer if you can't wash your hands at present. And don't lie. If the Ministry of Health calls you to contact trace, answer correctly.
All
This
right.
is not about persecution.
All right. So thank you so much, Dr. Asante Le Blanc, for another great conversation. I hope you certainly share this, each and every one of you looking on right now. Victoria Clinic, the website, Victoria Clinic, the Facebook page, and Instagram. Doctor, you're very present there. So we thank you for all the answers, as always, to our questions. You know, we have tons of them. So thank you.
Jenny, thank you. Be safe. See you next week, and we'll keep pressing on. But thank you very much, and
You're welcome.
good night to everyone.
This has been the live checkup. I am JD. Thank you so much for your time. Take care. See you soon.